Our next psychological influence is called behaviorism. And for behaviorism, we're going to look at B.F. Skinner. He's the man who made behaviorism popular culture. Skinner was a behaviorist, and as a behaviorist, he's only interested in observable behavior. What happened inside someone's mind didn't matter because it couldn't affect the world. And if you're going to train someone to change their behavior, then it didn't matter if they had problems inside their heads because their behavior wouldn't show it. His ideas are based on Pavlov's research and contiguity theory, which states a valuable reward received soon after a behavior will increase the chances of that behavior happening again. For example, if a child picks up a crayon and gets a candy for it, there's a good chance that child will pick up that crayon again. Reward. The theory is sound, and behaviorism is one of the most reliable treatment options we have today. But there is difficulty with behavior. For example, what happens if one time a child doesn't get the candy? What if the child discovers where the candy comes from and can go get the candy him or herself? Behaviorism is an effective tool for encouraging and discouraging behavior, but done wrong, the results can be worse than if no behavioral implementation had been done at all. It can have consequences far greater than if never been applied. The reason you're being taught behaviorism is not so you can go out and manipulate people, it's so that you can identify when people are trying to manipulate you. Though in terms of behaviorism, sometimes it doesn't even matter if you understand it's happening, it may still work. As humans, we should be able to identify when people are trying to train us and be able to work around that, should we decide to. Pavlov discovered a set of principles when that dog salivated at the bell instead of the food. Now this made no sense to Pavlov until he understood that the dog identified the coming of the food with the bell. And there's some definition words you need to know. Unconditioned stimulus. This is the stimulus that happens in the wild. The food, the smell of the food, something that triggers a response. The unconditioned response is the drooling, or the instinctive response to the unconditioned stimulus. Everything's instinctive at this point. When the association takes place, the conditioned stimulus would be the bell, or the unusual stimulus that wouldn't normally affect or cause a behavior. And the conditioned response is the drooling at the artificial stimulus instead of the natural stimulus. After having been trained, the dogs might generalize the stimulus to any other bell. Generalize meaning a similar stimulus that creates the same response, conditioned response. It didn't need to be the exact bell every time. It could have been something similar that reminded the dog of the bell. And if the bell had rung for a while without food responding, then the dog might learn that the bell doesn't necessarily mean food anymore, and the behavior, the drooling, would stop, would become extinct. Sometimes after extinction, however, the dog might hear the bell and start to drool at the memory of the food coming, and that would be called a spontaneous recovery. A better example might be an alcoholic who's been sober for years and then suddenly wanders into a bar and gets drunk. This is called falling off the wagon. He may feel miserable about it, but the reason it happened is biological. It's part of the behavioral system to go back to a behavior that was rewarding at one time, just to check to make sure it still doesn't work. Another example might be someone whose boyfriend or girlfriend have broken up with them, and they find themselves driving past that boyfriend or girlfriend's house like they used to. Perhaps looking for a return of the relationship, or the dog looking for a place it was fed as a puppy. There are 4 major systems in behavioral reward. 2 of them are for increasing behavior, 2 of them are for reducing behavior, either by giving or taking something away. Positive means giving something as a reward. Negative means taking something away. Reinforcement is anything that's done to increase a behavior, and punishment is anything that's done to decrease a behavior. The most common form is positive reinforcement. When you do something good, someone gives you a reward. Giving something to increase a behavior. Then there's positive punishment, giving something to decrease a behavior. Spanking. Giving someone a spanking to teach them not to run into the street. That's giving something to decrease a behavior. Then there's negative reinforcement, taking something away to increase a behavior. I'm taking this Xbox away until you clean your room. Taking something away to increase a behavior. And finally, negative punishment, which is taking something away to decrease the behavior. For example, if I say, stop it, 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 until you stop it, then I take something away and you decrease a behavior, negative punishment. However, let's say you got a boyfriend or girlfriend and they want you to do the dishes, and they say, do the dishes, and you say, I'll get to it. Do the dishes, I get to it. Do the dishes, later. Do the dishes, later. Do the dishes, fine, I'll do the dishes. You've just behaviorally taught them that if they ask long enough, you'll comply, which is the beginning of nagging. Let's say some kids want to stay up late, and you say, no, go to bed. And they say, can we please stay up? No. Can we please stay up? No. Can we please stay up? No. Can we please stay up? Fine, stay up, I don't care. You've just taught them that if they ask long enough, they'll get what they want. You've just taught them whining. So where else does behaviorism apply? Phobias. Most phobias are in fact learned. The problem is, when our brains rearrange themselves when we're very young, we forget, because when we learn language, our brain memory system reorganizes itself, and we tend to forget things that happen when we are very, very young. This happens about the age of 3. It's called infantile amnesia. So if something was very scary before the age of 3, we may well remain in fear of that thing for the rest of our lives without remembering why we're afraid of it. So how do you treat a fear that we don't even know why it's there? We treat it as behaviorism. Now there's two schools of thought on this. The first is flooding. For example, let's say if you're afraid of snakes, they throw you in a vat of snakes. And you're terrified, you're screaming, stress hormones. If you're afraid of crossing a bridge, they'll just carry you across a bridge. If you're afraid of pillows, they'll throw you into a bed full of pillows. If you're afraid of heights, they'll take you up on a skyscraper. The problem with this technique is that how much fear the person's going to be subjected to while they're dealing with the phobia. Yes, the phobia will be reduced, but if it gives the person PTSD, is that better than having the phobia? Is the treatment worse than having the problem? The second school of thought is the more humane one. It's called systemic desensitization. And that's where they expose you to whatever it is you're afraid of, little bits at a time, until you can get used to them in a safe environment, until eventually you get confident enough to interact with whatever the phobia was. For example, if someone's afraid of dogs, first they'll start you by bringing a picture of a puppy. Then they'll have the person interact with something fluffy. Then they might bring in one cute little puppy, and then a couple or 3 or 4 little puppies. And then they'll bring in the puppy's mama. And then they'll work their way up until the person's interacting with a big dog eventually. Now the phobia will probably never go away, but behaviorally, the person will be able to interact with whatever they're afraid of without too much trauma. Something else I need to mention is something called a primary reinforcer, and that's something that we need for life. For example, food or water or air. Sometimes sexual gratification is considered this because we need it for reproduction to survive. A secondary reinforcer is one we don't need for actual survival, which is everything else. Now these are all classical conditioning. There's another kind of conditioning called operant conditioning, in which the person's given a choice whether they want to participate and get the reward or not. For example, you give a classroom of kids a chance to go for a pizza party if they get all their work done and behave well. And then they decide that they want to turn the work in and behave well, then they get the pizza party. That's behaviorism, because it is training someone to alter their behavior, but they have to think about it first. Whereas classical conditioning is more about instinct. Operant conditioning requires more decision making and planning to get the reward. Behaviorism that we all use and maybe not even realize it. For example, if someone says thank you, are they using a behaviorism principle? Is thank you a behavioral reward for getting someone to do something again? And saying you're welcome, is that a behavioral reward for saying thank you? Get them to say thank you again. If you go into dog training, behaviorism is exactly what they use. And it works. Now they don't give the dog a reward every time if you want the behavior to continue without you rewarding it every time. Which gets us into behavioral reward schedule.